Hello everyone, my name is Jacqueline Tiema Massie, and welcome again to HPA 400. I look forward to serving as your co-lecturer with Mr. Carlo Govaya and guest lecturer Mrs. Sherry Weingard. Thank you again for registering for this course. We are so excited that you're here. Week one was a huge success. Many of you all dived into the discussion board forum and participated and were very engaged with our week one topic. And now we're looking forward to moving on with week two. I am currently a student in the DRPH program at UIC School of Public Health. I also graduated in 2001 from the MPH program, where I had a concentration in community health sciences with a focus in maternal and child health. So I'm very familiar with the coursework that many of you all have to take. I had to take it also myself, and I've also lived it. I worked in local governmental public health for 13 years at the Chicago Department of Public Health, and recently transitioned to the city of Chicago's Department of Family and Support Services, where I am the grants director, overseeing 3 staff that are responsible for authoring all of our department's grants. We have about 50 grants worth about $270 million. So I've had a taste of the school life and now have been able to exercise many of the concepts that we're going to cover in this course. So I'm hoping to be able to serve as a resource for you to talk about school-related matters, the concepts that we're covering in this course, but also any professional questions that you may also have about transitioning from being a public health student to a public health professional. Many of you all are already public health professionals, but please feel free to reach out to me to ask any of those questions as well. So this week we will be discussing community health, environmental health, and also the community health assessment process. And many of you all already understand and know that community health involves addressing health from a population lens. And this is done by multi-sector, multidisciplined individuals such as yourself. There are many public health organizations that address health or public health from various levels, whether that's international, national, state, city and town, county, and also from a neighborhood lens. Through my emergency preparedness training, I learned that public health problems first start locally and are to be addressed first locally. And while this is very true to emergency preparedness, it also is true to other specialties within public health. In Chicago, much of our data is reviewed from a neighborhood level. We are made up of 77 communities. And when we review health, we assess it from we assess many of our health concerns from reviewing the health of these 77 communities, looking for similarities, differences, or trends. Communities can be viewed from a geographic lens, but then they also can be viewed from other lenses, such as cultural or even socioeconomic. The word community comes from a Latin word meaning communis, things held in common. So commonalities in essence form communities. We are a student community. When we're talking about health, these commonalities vary. Again, whether they're socioeconomic, whether they're geographic, whether they're ethnic, these commonalities are how we view communities and also how we view health. As a public health professional, you are going to need to know your community. The American Public Health Association last year in 2014 hosted its 141st conference in New Orleans. The theme of that conference was healthography, how where you live affects your health and well-being. And this is very true. Where you live can dramatically impact the health of your community. whether that's environmental concerns or conditions such as pollution, whether it's social concerns such as poverty or violence, and maybe even behavioral concerns such as smoking, lack of good food access, and also poor habits, poor exercise habits, or other habits that impact the health of that population, whether that's in a positive way or in a negative way. The community health assessment process conducted by public health, hospitals, federally qualified health centers, and also community agencies attempts to assess the health of their target community. And that's reviewing the health issues or concerns, but not only understanding what those health issues and concerns are, but to what extent they are a problem within that community. Many of you all will be involved in community health assessment community health assessments in your career. And some of you may have already conducted these. We'll discuss this also in week 2 in the discussion board. So, I'm hoping that you will find the readings and the exercises for this week helpful to introducing you to the concepts of community health, environmental health, and the community health assessment process. Please do reach out if you have any additional questions. Both myself and Carlo are here as resources for you. Also, our TA, Hansoon, is also available to answer any of your questions. Please post questions that you think the entire course can benefit from on the Q&A discussion board thread. If you have a specific question that's of a personal nature, please do email us. The best way to contact me is by emailing both my UIC email, jtiema1@uic.edu, and also Jacqueline Massie at Gmail. If you copy both, I will be sure to get your email and your question. And we look forward to engaging with you in the week 2 discussion board. And again, welcome to the course.